Hello and welcome to Health Professional Radio. So glad that you could join us today. A newly emerging industry of patient advocacy is growing rapidly as more consumers and families are hiring private professional health advocates. Up to 440,000 patients die in hospital each year due to medical errors. Our guest in studio today is Teri Dreher, RN and CEO of North Shore Patient Advocates, Chicagoland's largest, and not only that, but the only patient advocacy facility to use a team approach when it comes to protecting a patient's rights. And she's here with us today to talk about what she looks for when she's hiring someone to be a private patient advocate. How are you doing today, Teri?
I'm doing well. Thank you, Neal. It's great to be here.
Glad that you're here. The healthcare system has become increasingly complex and profit-driven. Let's be honest about it. Profit-driven. Patients pretty much get lost in the shuffle on a daily basis. Now, you've got years of critical care nursing, and you founded North Shore Patient Advocates, as I said, the Chicago area's largest advocacy agency in 2011. What prompted you to start a private patient advocacy facility?
Well, actually, two different things prompted me to start North Shore Patient Advocates. One, we had a family crisis. My father-in-law almost died when we were on a vacation, and so I got the unique vantage point of seeing what family members go through, and it just really broke my heart to see, from a family member's perspective, the pain, the fear, the anxiety, the just terror involved when someone has a near-death experience and they don't have a nurse in the family. People are really struggling right now. And the second thing that happened was I had an experience where I was almost fired from a hospital that I was working at because I strongly advocated for a patient that I had grown very close to for 6 weeks, and she had a lot of complications, and I talked to the doctor about why certain tests weren't being done to find out why she was having all of these major complications, and he got really upset with me. And to make a long story short, I found myself on a 10-day suspension shortly after that for a charting error. And honestly, Neal, it made me so mad. I just said, because I'd been their top ICU nurse, took care of all the VIPs in the hospital for a long time, and I had really been a great nurse for that institution. And when I almost got fired, I thought, okay, well, I'm going to make sure that nobody ever tells me not to advocate for a patient again. And so I went out and started my own business because I really understand what people are going through, and I have the skills, the experience, and the passion for helping to prevent medical error for people that don't have a nurse or a doctor in the family.
Now, North Shore Patient Advocates, it's been around for 4 years now, but this field of patient advocacy has been growing by leaps and bounds, particularly since the Affordable Care Act has been implemented. About 20 or so universities now offer graduate certificate programs. There are two leading trade associations, the National Association of Healthcare Advocacy Consultants and the Alliance of Professional Health Advocates. You belong to both. Of course, It makes sense that you would belong to both. Talk about some of the credentialing requirements for a new hire, say, right out of university.
Well, there is actually no national credential yet. We're in the process right now. The Alliance of Professional Health Advocates is on the leading edge, and NAHAC is also helping with this process too. The National Association of Healthcare Advocacy Consultants spent much of last year putting together a standards and best practices document. So there could be some sort of standards and ethics laid down regarding who would be qualified for this. And the next step is going to be developing a national test. I'm a nurse. I believe that nurses are naturally great patient advocates, but we're not the only people that can be strong patient advocates. When I hire a new person to come and join the team here at North Shore Patient Advocates, I'm looking very closely at nurses because I think they have a lot of the skill sets that I find valuable. I want master's prepared nurses that have strong clinical experience, good case management experience, and a real passion for patient advocacy. I want them to also be the kind of person you'd like to have in your family, a very nice person, loves people, especially loves older people and people with disabilities. I want somebody that is just a super nice person, a super competent person, a very reliable person that goes above and beyond the call of duty, doing whatever we have to do to help patients navigate the system safely today.
Now, even though they possess the skill sets required to be an effective private patient advocate, what type of training do they receive that is specific to North Shore patient advocates?
Well, we have a whole training process that I put people through. We have a lot of documentation, things, and kind of best standards of what we found really helps. One thing that we offer clients quite frequently is to do a complete review of their medical records and develop a comprehensive medical profile and care plan so that all bases are covered, all the different areas that people are struggling with are laid out in a plan that nurses are trained how to do care plans very easily. We also have people that work with us that are not nurses. We have a social worker that is just really excellent with billing and insurance resolution issues, and we also have a dietitian that does really, really comprehensive education training on nutrition to help people improve their nutritional status. And we utilize not only traditional modalities, but also an integrative approaches. And integrative is kind of non-traditional medicine, like supplements, diet, chiropractic, acupressure. We have a lot of really wonderful partners out there that help us give our clients excellent care.
How expensive is this excellent care? I mean, are we talking about folks that are on Medicare, Medicaid?
No, we put together affordable packages. If people wanted to hire us per hour, we cost less than attorneys do, and I think it's probably a really good deal because we save people's lives, not just protect their finances and their property and everything. Actually, a lot of the people that really get what we do the best are estate planning attorneys and elder law attorneys. They see people constantly that are struggling with modern health care, and because they don't understand modern health care or what good medicine looks like or what good referrals are, they pick up the phone and call us so we can put the whole package together and keep people safe.
In your opinion, give us the number one tip for advocating for a sick family member.
Just show up, be there, bring a notebook along, write down questions, do the research, and make sure that nobody touches your family member in the hospital without disinfecting their hands. Hospitals and nursing homes are just breeding grounds for germs right now, and for an elderly, not well patient to go into the hospital for a relatively minor ailment and contract one of the new drug-resistant microorganisms that are so prevalent in hospitals today could be deadly. So pay attention to infection control, confusion, weakness, make sure they don't fall, and just write everything down and get people in and out of the hospital just as quickly as possible.
And where can we get more information about North Shore Patient Advocates?
Well, our website, Neal, is www.northshorern.com, and our direct office number is 847-612-6684. People can also contact us through our website and send us an email. Thank you.
Thank you. You've been listening to Health Professional Radio, and I'm your host, Neal Howard, talking in studio today with Teri Dreher, RN, and CEO and founder of North Shore Patient Advocates. We've been here talking about the complexity of the healthcare system and how important it is to have the patient's rights protected, especially when the confusion and, the fast-paced world of today's healthcare system sometimes offers some really deadly results. It's been great having you here with us today.
Thank you so much, Neal. It was a joy to be with you.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.